New at 6. Right now, there's a cancer drug shortage, putting lives on the line. Commonly prescribed drugs for cancer patients, especially for women, are in short supply, forcing doctors to reduce doses of chemotherapy or delay treatment. Here at ABC 10, we stand for you. I sat down one-on-one with patients to understand not only what this shortage means to their survival, but also what it says about how we get our life-saving medicine.
Ready? Which one?
Marie Kennedy, a communication specialist in Natomas, has been active her whole life.
That's the Italian village that we skied to.
But that was suddenly put on pause.
I had just been on a 9-day river rafting trip down the Colorado River. And I got home and I was feeling pretty tired, but I didn't think anything about it.
And her tiredness didn't go away, so she went to the doctor, who ran several tests that changed her life.
We discovered that not only did I have cancer, but I had metastatic cancer, had spread. I had it in my stomach, I had it in my lungs, I had it in my ovaries.
Did you have any fears that the chemo wouldn't do its job?
My only fear was not to be there and see my kids continue to become the wonderful people that they are.
Thankfully, Marie's body responded well to chemotherapy, the standard of care for hundreds of thousands of cancer patients. But now that treatment is threatened because of a shortage of more than a dozen common cancer drugs, including cisplatin, one of the drugs Marie used, and carboplatin. They're used to treat a wide range of common cancers, including cervical, breast, and lung cancers.
These drugs became what we call frontline or first line because it gives that individual the best chance to have a positive outcome.
The National Cancer Institute says cisplatin and similar drugs are prescribed to up to 20% of all cancer patients.
And why now? Why are we facing this now? How did this come about?
And the common theme is that these are the generics. There is a less of an interest in manufacturing them and a difficulty in creating a business model that will support the cost of these low-cost generic life-saving drugs.
Not only is it an economic issue, it's also a supply chain issue and a communication issue. Some of the challenges are the U.S. drug market is so large. Also, the aging population's increasing the demand for such drugs. And in India, one of the world's largest raw materials manufacturers for these drugs has temporarily stopped production. To boost supply during the shortage, the FDA is temporarily allowing imports of cisplatin and will, quote, very carefully assess the overseas product for quality, making sure it's safe for U.S. patients, and is aware that orders may have been placed and products should be arriving soon.
It's very critical to recovery. I don't know what would have happened to me if they wouldn't be able to give me that standard of care.
Yeah, Chris, this is such a serious issue. I do want to let the viewers know that Sutter Health and Kaiser tell ABC 10 that they are working on identifying alternative treatments as necessary. And also, a major drug maker, Pfizer, we all know that name. They create a COVID-19 vaccine. They tell us that they are not having a shortage of chemo drugs, a very complicated situation where there is no magic pill for this. So it's impacting a lot of lives.
Well, as many know, my mother was a breast cancer survivor. And, you know, it's just such a stressful time as it is. The last thing you want to be worried about is if you can get the medication that you need to try and survive. And so it's good to hear that you've been following up on this. And I do know that we have more information on our website, more statements and things of that nature.
We encourage everyone to read that on their own time. And it's a very serious issue, like we said. Yes.